I would like to briefly talk about informed consent for thyroid examinations in Fukushima. Because the thyroid examination is an ultrasound-based screening for thyroid cancer, the decision to participate in thyroid examinations must be voluntary. We have noted, however, that school examination is conducted in an opt-out manner that cannot ensure voluntary. In addition, consent to participate in screening must be based on a full understanding of its benefits and harms. Although thyroid examination in Fukushima is performed with written consent, it is doubtful that there is sufficient understanding of the harms of thyroid examinations, especially overdiagnosis. We would like to report a summary of the findings on whether understanding of the harms is sufficient or not. Here, the left chart shows that caregivers of the screening subjects know little about the harms of thyroid examination based on a questionnaire before an explanatory meeting around 2016. The right chart shows that residents of Fukushima, including caregivers, know little about the harms of thyroid examination according to the questionnaire before an educational session for thyroid cancer screening in 2018. Overdiagnosis is a principal harm of thyroid cancer screening, which seems difficult to understand, unacceptable, and anxiety-producing for residents. In this slide, the left chart shows poor understanding about the harm of thyroid examination among medical and non-medical college students prior to a lecture on cancer screening. Moreover, most of the subjects of thyroid examination in Fukushima did not understand the harms of thyroid examinations as shown in the right chart. This graph is a result of a scenario study for medical staff. We presented a scenario in which thyroid cancer screening would be conducted after a nuclear accident like Fukushima and asked whether they would participate in thyroid cancer screening at each step. Without an explanation of the benefits and harms, almost all respondents choose to participate. The result was the same even after reading the explanatory document currently used in Fukushima. However, after a detailed explanation of the harms of overdiagnosis, the number of respondents who would participate decreased. Decision-making of participation in thyroid cancer screening needs a detailed explanation of the harms of overdiagnosis. Many residents of Fukushima, including caregivers and subjects of thyroid examinations, are unaware of its harms. Sufficient information regarding the harms of thyroid examination is not provided prior to decision-making. Under this situation, even if written consent is obtained, it cannot be considered obtaining informed consent. It is uninformed consent. The 4th International Symposium of JCJCT is going to be held in December 2023 on demand.